Blood consists of two components, plasma and formed elements. Plasma is the liquid component of blood. It has a density only slightly greater than water. Plasma contains dissolved proteins and other solutes such as nutrients, electrolytes, and wastes. Formed elements are the blood cells. These include the red blood cells, white blood cells, and cell fragments or platelets that are suspended in the plasma. The red blood cells transport oxygen and carbon dioxide. White blood cells are components of the immune system and are less numerous than red blood cells. Platelets are small membrane-enclosed packets of cytoplasm that contain enzymes, clotting factors, and proteins that play a role in blood clotting. Whole blood is a mixture of plasma and formed elements. Its composition can be separated or fractionated for clinical purposes. Whole blood is sticky, cohesive, and resistant to flow. These characteristics determine the viscosity of the solution. Such solutions are then compared with pure water, which has a viscosity set at 1. Blood plasma has a viscosity of 1.5, but whole blood is 5 times as viscous as water. The high viscosity of blood results from the interactions among dissolved proteins, formed elements, and water molecules in plasma. We can estimate blood volume in liters for a person of either sex by calculating 7% of the body weight in kilograms. Adult males typically have more blood than females do. A person that is normovolemic has normal blood volume. A person with low blood volume would be considered hypovolemic, and a person with excessive blood volume would be hypervolemic. Blood is slightly alkaline, with a pH range between 7.35 and 7.45, and a temperature of 38 degrees Celsius, which is slightly higher than normal body temperature. The concentration of dissolved oxygen in plasma is higher than that of interstitial fluid. As a result, oxygen diffuses out of the bloodstream and into peripheral tissues that need it. The carbon dioxide concentration in interstitial fluid is higher than that of plasma, so carbon dioxide diffuses out of the tissues and into the bloodstream. Plasma contains significant quantities of dissolved proteins, while interstitial fluid does not. The large size and globular shapes of these plasma proteins prevent them from crossing capillary walls. Therefore, they remain trapped within the cardiovascular system. There are 3 major classes of plasma proteins: albumins, globulins, and fibrinogen. Albumins are the major contributors to osmotic pressure and are important in transporting fatty acids, thyroid hormones, steroid hormones, and other substances. Globulins come in 2 forms: immunoglobulins and transport globulins. Immunoglobulins are also known as antibodies. These aid in the body's defenses. Transport globulins bind small ions, hormones, or compounds that are either insoluble or will be filtered out of the blood by the kidneys. Fibrinogen is a plasma protein essential for normal blood clotting. The major cellular components of blood are the erythrocytes, or red blood cells, and the leukocytes, or white blood cells. There are 2 major classes of leukocytes: granular and agranular. Granular leukocytes have cytoplasmic granules, whereas the agranular leukocytes lack cytoplasmic granules. The percentage of whole blood containing formed elements is known as the hematocrit. The hematocrit in an average adult male is 45, and the range is between 40 and 54. The hematocrit in an average adult woman is 42, and the range is 37 to 47. The hematocrit is a good approximation of the volume of red blood cells. As a result, hematocrit values are reported as volume packed of red blood cells, or, more simply, packed cell volume. Each red blood cell is a biconcave disc. The biconcave shape gives red blood cells a large surface area. The large surface area permits rapid diffusion between the red blood cell cytoplasm and the surrounding plasma. As blood circulates from the capillaries of the lungs to the capillaries in the peripheral tissues and then back to the lungs, the red blood cells absorb and release respiratory gases. During the differentiation and maturation process, red blood cells lose most of their organelles. Mature red blood cells do not have mitochondria, an endoplasmic reticulum, ribosomes, or a nucleus. This ensures that the absorbed oxygen will be carried to peripheral tissues and not used up by the red blood cells themselves. Hemoglobin is responsible for the cell's ability to transport oxygen and carbon dioxide. Each hemoglobin chain contains a single molecule of heme. Each heme unit holds an ion that will interact with one oxygen molecule, forming oxyhemoglobin. A hemoglobin molecule whose iron is not bound to oxygen is called deoxyhemoglobin. Oxygenated hemoglobin has a bright red color, while deoxygenated hemoglobin has a deep red color. Hemoglobin carries 23% of the carbon dioxide transported in blood. Carbon dioxide binds to the amino acids of the globin subunits. When the plasma oxygen level is low and carbon dioxide levels are elevated, which occurs in the peripheral capillaries, hemoglobin releases oxygen, and the alpha and beta chains of hemoglobin bind carbon dioxide, forming carbaminohemoglobin. When the plasma oxygen level is high and carbon dioxide level is low, which occurs in capillaries by the lungs, the red blood cells absorb oxygen, which is then bound to hemoglobin, and the red blood cells release their carbon dioxide. The presence or absence of specific surface antigens in the red blood cell plasma membrane determines an individual's blood type. The membrane of a red blood cell contains a number of surface antigens, or agglutinogens, that are exposed to the blood plasma. There are 3 surface antigens that are of particular importance. These are A, B, and Rh. The red blood cells of each person have a characteristic combination of surface antigens. For example, type A has antigen A. Type B has antigen B. Type AB has both antigens A and B, and type O does not have either antigen A or antigen B. The Rh blood group is based on the presence or absence of the Rh surface antigen. The term Rh positive indicates the presence of this antigen, commonly called the Rh factor. The absence of this antigen is indicated as Rh negative. The types are simply reported as O negative, A positive, B negative, and so on. Blood plasma contains antibodies called agglutinins that will attack foreign surface antigens. For a person with a blood type A, the blood plasma contains anti-B antibodies that will attack type B surface antigens. Therefore, this person cannot receive type B or type AB blood. For a person with blood type B, their plasma contains anti-A antibodies that will attack type A surface antigens. A person with type B blood cannot receive type A or type AB blood. The red blood cells of an individual with type O blood will have neither A nor B surface antigens, and that person's plasma contains both anti-A and anti-B antibodies. A person with type O blood cannot receive type A, type B, or type AB blood. A type AB individual has red blood cells containing both A and B surface antigens. This person's blood plasma will not contain either anti-A or anti-B antibodies. For this reason, people with type AB blood can receive all blood types. The plasma of an Rh negative person does not contain anti-Rh antibodies, whereas the plasma of an Rh positive person does. Rh can become a factor in cases in which an Rh positive man impregnates an Rh negative woman with an Rh-positive fetus. In some cases, the Rh-positive fetus antigens can enter the mother's blood during delivery. This will cause the mother to produce anti-Rh antibodies. In the next Rh-positive pregnancy, the mother's anti-Rh antibodies will attack fetal red blood cells. White blood cells defend the body against invasion by pathogens and remove toxins, wastes, and abnormal or damaged cells. Leukocytes are divided into two groups, the granular leukocytes, or granulocytes, and agranular leukocytes, or agranulocytes. A stained blood smear provides a differential count of the white blood cell population. A condition in which there are too few lymphocytes is called lymphopenia, whereas a condition of lymphocytosis means the condition of having an unusually high number of lymphocytes. When body cells are infected or damaged, they release chemicals into the interstitial fluids that attract leukocytes. This attraction to chemical stimuli is called chemotaxis. White blood cells are transported in the bloodstream to the invading pathogens, damaged tissues, and white blood cells already in the damaged tissues. They then cross the endothelial lining of the capillary by squeezing between adjacent endothelial cells in a process called diapetesis, or emigration. Granular leukocytes are classified as neutrophils, eosinophils, or basophils on the basis of their staining characteristics. Neutrophils are highly mobile and are usually the first white blood cells to arrive at the site of the injury. They are active phagocytes and specialize in attacking and digesting bacteria. Eosinophils attack objects that are coated with antibodies. The number of eosinophils increases dramatically during an allergic reaction or parasitic infection. These white blood cells release enzymes that reduce inflammation. Basophils migrate to sites of injury and cross the capillary endothelium into the damaged tissue. There, the basophils release their granules into the interstitial fluids. These granules contain histamine and heparin. The histamine functions to dilate the blood vessels, whereas heparin prevents blood clotting. There are two classes of agranular leukocytes, monocytes and lymphocytes. Monocytes circulate for just a few days before entering peripheral tissues. Macrophages, found in connective tissue, are immobilized and fixed. Macrophages outside the bloodstream are called free macrophages. These are highly mobile, phagocytic cells. They usually arrive at the site of injury shortly after the first neutrophils arrive. While phagocytizing, free and fixed macrophages release chemicals that attract and stimulate other monocytes and other phagocytic cells. The fibroblasts then begin to produce scar tissue to wall off the injured area. Lymphocytes are the primary cells of the lymphatic system. The lymphatic system is a network of special vessels and organs that are distinct, yet still connected to the cardiovascular system. Lymphocytes are responsible for what is called specific immunity. Specific immunity is the ability of the body to attack invading pathogens or foreign proteins on an individual basis. The circulating blood contains three functional classes of lymphocytes: T cells or T lymphocytes, the B cells or B lymphocytes, and the natural killer cells or NK cells. T cells enter peripheral tissues and attack foreign cells directly. B cells differentiate into plasma cells or plasmacytes. Plasma cells then secrete antibodies that attack foreign cells or proteins. Natural killer cells are responsible for the immune surveillance and destruction of abnormal cells. These cells are sometimes known as large granular lymphocytes and are important in the prevention of cancer. Platelets are small membrane-bound, anucleated cytoplasmic fragments that play an important role in blood clotting. Red bone marrow contains megakaryocytes which form these platelets. As the megacytes begin to form, the megakaryocytes form platelets by shedding cytoplasm in the form of small membrane-enclosed packets that then enter circulation. A mature megakaryocyte gradually loses all of its cytoplasm and produces around 4,000 platelets. At the end of the megakaryocyte's life cycle, phagocytes engulf the nucleus and break it down for recycling. One-third of the platelets in the body are held in the spleen and other vascular organs rather than in the circulating blood. This provides a reserve that can be mobilized during a circulatory crisis, such as severe bleeding. Thank you for watching.